I'd like to talk about some of your suggestions. You made two proposals. It was related to the Regional Health Authorities Act. You wanted to make sure that whenever implementing new actions related to health, we should still give the patient the right to have access to healthcare services in their own language. Then you said that both networks should make sure that people have access to services in French if they want to. Mr. Iggs, your province's premier was not really open to these suggestions. I'd like to know if he has changed his mind. Are you aware of any other solutions to solve this problem? The government tabled a bill, and they didn't include these recommendations. We'll have to see if they are going to modify it or not. These recommendations were more technical. We wanted to make sure that core obligations that are enshrined in the Official Languages Act are respected. We wanted to make sure that these obligations also applied in healthcare. Earlier, you mentioned that sometimes an employee walks around with a computer that translates for them. It sounds a little bit lazy when we know that we could probably invest in better technology that could help in hospitals. I understand that you might not be happy when you hear something like that. No. We know that we have been using such a technology for immigrants and people who speak other languages. As I said in the past, we will use technology if we have to use it. But I still believe that we should only use this technology as a last resort. We don't want to put any patient in danger. But if we don't do anything, it'll keep happening. So we're not putting a lot of effort into it. I'll change topics for my other question. I just wanted to know if anything changed in that regard. I would like to talk about credentials for healthcare professionals. There are some provincial exams that are not necessarily the same all over the country. It means that mobility is pretty limited when it comes to healthcare. I wondered if it was a problem in your province. You're talking about what exams? I'm talking about exams for nurses, for example. They need to qualify. There have been suggestions that there should be harmonized exams all over the country. That way it would facilitate the mobility of healthcare professionals. It would give more accessibility. It relates to mobility. It would make it a lot easier when it comes to nurses' mobility if we could have more professionals coming to our province. But at the end of the day, it works with your own province. The government cannot do anything regarding this issue. It's auto-regulated. But of course, it would really help. It would, however, be a really significant project because we would have to work with different professional associations all over Canada. So if I understand correctly, this is not something we're actively working on. I think that we're hearing a little bit more about it. This is something that has been talked about in the Atlantic region. I think that they understood that we need to do something. However, when it comes to official languages, we need to understand that even with more mobility, it doesn't necessarily mean that it's going to help the minority language community. Will it really help French speakers in New Brunswick? Will it really help the minority language community? I don't know. We need to make sure that we have services for these communities. When it comes to complaints, you said you got many complaints. So I was wondering if the government was open to receiving complaints. Are they doing anything about it, or are they only gathering data? I worked with different organizations. I can only make recommendations. We give recommendations, and organizations are aware of these recommendations, and they're collaborating with us in order to implement them. But of course, we are facing a labor shortage, but that's not always a problem. There's also a problem related to the institutions themselves. I think I need to promote what's going on. We need to find a way to collaborate with different institutions to make sure that they could implement these recommendations. That way, employees would be aware of their obligations when it comes to languages. That's where I mostly work.